Sorry. Okay. There we go.
My name's Emily, and today I'm going to talk all about strokes, so the basics of the strokes. Have you ever had a stroke?
No.
Probably, probably not. But you may know someone who has had a stroke. So
Yes.
Strokes don't just happen to old people. They can happen to younger people. And it's important to know the signs and symptoms, and the knowledge might help you recognize a stroke in someone else. In my experience working as a CNA, strokes are scary. People come into the emergency department and they're scared. They don't know what's happening to them. They're frustrated because their abilities have changed. I'm going to talk about the different types of strokes, signs and symptoms of strokes, and what the risk factors are for having a stroke. Strokes are serious health issues that can be separated into different types, identified by specific signs and symptoms and reduced by lowering the risk factors. So first we'll talk about the two different types of strokes. So first we have ischemic strokes, which is the lack of or absence of blood flow to the brain. Here we have a ischemic stroke here on this side. About 87% of strokes are ischemic strokes. They can be caused by a blood clot or not enough blood flow to the brain. So usually like after a heart attack, it's a possibility that you could have a stroke due to the lack of blood flow. Transient ischemic attacks are mini strokes. Usually they are ischemic strokes that usually only last 5 minutes or so. They're still very serious, but it's important to get treatment for those as well. TIAs can also be warning signs for future strokes. Next, we have a hemorrhagic stroke, which is a ruptured blood vessel causing blood to leak out into the brain cavity. So there's two different types of hemorrhagic strokes. There's intracerebral strokes, which is when a blood vessel ruptures into the brain tissue and bleeds into the brain. It's mainly caused by hypertension, but can also be caused by trauma or substance abuse, as well as vascular malformations. So aneurysms. Last, we have a subarachnoid hemorrhage, which is a blood vessel ruptures near the surface of the brain and blood fills the cavity between the brain and the skull, which causes pressure and bad things. There can be many causes to the subarachnoid hemorrhage. However, the primary causes are burst aneurysms or arteriovenous malfunctions, which are AVMs. It's a genetic disorder which looks like this. So normal blood flow should look like this. Next, I'm going to talk about the signs and symptoms of a stroke. So the signs and symptoms of a stroke we use at the hospital are put into an acronym of FAST. F stands for face, is there drooping of one side of the face. A stands for arm, is there weakness in the arms if you ask them to hold their arms out. Speech, is there difficulty speaking or slurred speech present. And T stands for time, so it's time to call 911. Time is tissue, so the longer you wait to get help, the bigger the area damaged would be. There's also an acronym STROKE, S-T-R-O-K-E. S stands for speech or any problems with language. T stands for tingling or any numbness in the body. R stands for remembering or any problems with memory. O stands for off balance or problems with coordination. K stands for killer headache. And E stands for eyes or any problems with vision changes. So remember, be fast when it comes to a stroke. And so she also has in My Stroke of Insight by Jill Bolt Taylor. She has a list of signs and symptoms there. So last we'll talk about the risk factors of having a stroke. Risk factors for having a stroke, according to the CDC website, conditions that increase risk factor include previously having a stroke or TIA, definitely makes your chances higher. High blood pressure can cause a stroke. If there are any weakened vessels, and the wall vessels. High cholesterol can cause vessel blockages due to cholesterol buildup and damage the arteries. Heart disease can cause plaque buildup and form clots. Diabetes causes sugar buildup in the blood and prevents oxygen and nutrients from getting to the brain. And sickle cell disease can cause red blood cells to form an abnormal shape, which can cause smaller blockages in smaller arteries and capillaries. So according to the CDC website, behaviors that increase risk factors are really the only controllable factor that we have. Behaviors that increase the stroke are an unhealthy diet, which would be a diet high in saturated fats and trans fats, as well as in high in cholesterol. Physical inactivity can lead to other health issues that can lead to strokes, as well as obesity. Too much alcohol can raise the blood pressure and increase fats in the arteries and harden and can cause a blockage. Tobacco use can damage the heart and blood vessels, as well as, according to the CDC website, family history. So any genetic factors, age is a factor. Women are more likely than men to have strokes. The chance of having a stroke nearly doubles after the age of 55. So we just heard the different things that can increase the risk of having a stroke, and really the only ones we're able to control are the behaviors. So today we've heard about ischemic and hemorrhagic strokes and the difference between them. We've talked about the signs and symptoms of strokes, and we're going to finish with talking about the risk factors that can increase the risk of having a stroke. So you may not have had a stroke, but maybe now you could recognize one should you have one somewhere in your future, whether it's a family member or someone at the store. Remember to be fast in regards to a stroke.
Oh, God. Sorry, I'm like, yeah, no, I know. I was like, how fast can I talk?
You have to show us again.
Oh, shit.
Oh, perfect time.